I deal mainly with people when they come to me, they're already in trouble. So we have to deal with substance misuse. Now everybody knows about opiates and crack probably, but there are quite a few substances out there that are misused. And if people are that way inclined and you're seeing them for opiates, they're probably using other things as well. So hopefully we're going to have a little look at what they are. Some of this might be basic to you because I've seen some GPs I've worked with out there that are very experienced. So apologies, but I didn't know what sort of range of experience I was going to face today. So we'll go from the basics. So we'll look at what drugs of misuse are and to give an overview of the main categories, please. So a drug is something that affects your body. It must be able to pass through the body into the brain, the central nervous system, interfering with the neurotransmitters and neuroreceptors. Some are illegal, the obvious ones, cannabis, cocaine, heroin, club drugs, which I think probably Monty will touch on later. And some are legal, alcohol, cigarettes and glue, the worst ones, okay? They're the legal ones. Okay. Drug abuse we class as a deliberate use of a harmful drug or a misuse of a prescribed drug, which we saw this morning. A person who is dependent on psychoactive substances and being mentally or physically dependent on drugs are liable to have a damaging physical or mental effect, temporary or permanently. Okay. So these are the basic categories. We've got depressant. Now when I say depressant, I'm talking central nervous system depressant, not being depressed. We can see it slows down or depresses the nervous system. In moderate doses, it makes you feel relaxed and euphoric, which is the problem with things like codeine, because it's quite a nice feeling, it takes away anxiety. In larger doses, they can cause unconsciousness, reduced breathing, heart rate, and death, if it's overdone. The stimulant is the opposite. It speeds everything up. It speeds up the nervous system. It can make you feel more alert or awake, increases the heart rate, the temperature, and the blood pressure. And some will also constrict blood vessels, which really pushes up the blood pressure. And hallucinogens, which are coming back in fashion, especially among students. Okay, distorts the user's perception of reality, dilation of pupil and loss of appetite. That can happen with stimulants too. Visual, auditory, tactile hallucinations can be present. So basically, as somebody who treats people like this, if you don't know what people have taken, and sometimes people don't know what they've taken, if you can determine what the symptoms are, whether it's a stimulant, a depressant or a hallucinogen, you basically treat them all the same. So the approach to treatment is the same for all stimulants, the same to all depressants. The real difference is, especially with depressants, there might be some harm reduction as far as buprenorphine and methadone is concerned, but the psychosocial aspect is the same. So, some examples of these are obviously some of these you're going to know: heroin, cannabis, gamma hydroxybutyrate, which is increasingly common, ketamine, alcohol and nitrous oxide that was mentioned earlier. I just happen to have a couple of things in my pocket. I don't normally carry these around with me, but you've all seen these lying around the floor, yeah? We'll have another look at that in a minute. Common stimulants, crack, we all know, cocaine powder. There is a misconception that crack and cocaine are two different things. They're exactly the same. They're just in two different formats, so they're ingested differently. One isn't stronger than the other, it's just ingested differently. Amphetamine's been around for a long time. Methamphetamine, crystal meth, becoming far more common again among students now. Ecstasy, it's sort of in fashion, but it's starting to go out of fashion. Methadone is going out of fashion. That's a methcathinone. Methamphetamine is really taken over from methadone. And the hallucinogens, everybody knows LSD. Magic mushrooms. There are some states in America now that are bringing them back and making them illegal again. Not sure why. Ketamine, cannabis and ecstasy can have hallucinogenic effects, depending on how much is taken. Nitrous oxide, gamma hydroxybutyrate. Mescaline is making a comeback. DMT, I don't know if you've heard of dimethyltryptamine and the ayahuasca experience. It's a natural hallucinogen, very strong. It comes from the ayahuasca vine in Peru, And the experience is to go to Peru, you go out to the jungle, you drink the liquid made from the roots. It's a purgative, so you have to keep it down long enough to get the effect, and then everything comes up. And then you trip for about 4 hours, and then the shaman will take you through your spiritual trip. Yeah. I had a client about 6 months ago, and she travels all over the world. She said, "Oh, I've done no ayahuasca experience." I thought, "You've been to Peru?" She went, "No, we did it at Epping Forest." So, which is probably far more comfortable, less insects and poisonous snakes, so you would imagine. And the other one, 2CP, and 2CB, I've noticed appearing at the university recently. It's a long-lasting hallucinogen. It's easy to get hold of, apparently, the students have said. It takes about 3 or 4 hours to take effect, but will last 10 to 20 hours. It's quite damaging as far as getting coursework done. Okay? Okay. This is another breakdown. Dissociative anesthetics, nitrous oxide, gamma hydroxybutyrate, ketamine. Nitrous oxide and ketamine were regarded as harmless. They're used on people, used on animals. We now know that used heavily for long periods they're not. Ketamine is extremely caustic to the urinary tract. We've got people wearing nappies, they've had bladders removed. It's really horrendous. Nitrous oxide, as mentioned earlier, we now know reduces vitamin B in the brain. So you get similar things to Wernicke-Korsakoff's disease, or syndrome I should say, much quicker than you do with alcohol. Much quicker. GHB, disgusting stuff. The trouble with GHB is it's very critical with the dose. If you've got a good tolerance, 1 meal is a good dose every 2 or 3 hours. 1.1 can put you in what's called a G-hole, a coma. It's that critical. And because it's a dissociative anesthetic, people tend to take it, and 20 minutes later they've forgotten they're taking it, and take some more. I think you might be able to that one, Monty. Mm-hmm. Analgesics, we've been talking about these all morning. Heroin, methadone, buprenorphine, codeine, morphine, opium, oxycodone, the big one at the moment, tramadol, fentanyl, and there are others, paramol, for instance. And THCs, spice is now classed as a THC, which I'll go into in a bit. And any substance that mimics a THC, i.e. works on the CB1 receptor in the body, is now a class drug. It's a class B drug, okay? This is how it breaks down. I'm doing this because it sort of relates to spice and NPSs. This is the ordinary cannabis plant. There are about 100 cannabinoids in the plant. 40% is CBG, cannabidiol. This, when the plant matures, breaks down into tetrahydrocannabinol and cannabidiol. Now we know what CBD is. It's now a legal oil. It's an antipsychotic, supposedly an anxiolytic. THC is the psychotic part, but you can see they're balanced, 20% each. THC is a much better pain management than CBD, but so far they haven't produced an oil that doesn't get you high, so it's not legal. Now the problem is they now splice these together, and there are hybrid plants that produce skunk. And this was to increase the THCs. So now skunk is around 40% THC and less than 1% CBD. So we're looking at all psychotic, no antipsychotic. Hence the big difference in the hit. Now, in the body, I'm sure a lot of you know, we have endocannabinoids. We use them naturally. We use it for homeostasis. So it keeps everything just about right. So when you take in cannabis, you upset the homeostasis. So all of our little systems that keep everything not too much, not to get upset. When you increase the THCs to 40%, you really do upset them a lot. And it can be hallucinogenic, used heavily, can cause paranoia, severe anxiety. The reason I'm saying this is spice. When it first came out, the effective THCs that spies use, and it's not THC, it's just a pseudo THC, was 100 times stronger than skunk. Last year, the latest quote was that spice is now 800 times stronger than skunk, which is why we're seeing the psychotic events, the catalepsy. I witnessed somebody coming down off of skunk, and it was like watching a benzo come down. It was really severe. You don't get come downs off cannabis, but with spice, it's really, really severe. So we don't know what's going to happen next. Plus, they're mixing it. They mix it with ketamine, they mix it with amphetamines. It's not used heavily in public. Homeless, yes, because it's cheap. Students are starting to use it, but where it's mainly used is in prisons, because it doesn't come up on a urine drug screen as THCs. Okay. So, there was a lot of pressure to do something about legal highs, and they're still getting called that. So in 2016, they produced. The trouble with with spice, as you probably know, is every time they classified it, they would change a molecular bond. It no longer fitted the description, so it wasn't classified anymore. So they changed the approach, and what they've said is these substances are still legal. You can still possess them, still use them, but there are heavy fines for anybody trafficking or dealing. So what they've done is attack the dealers. So you notice that most of the head shops have disappeared from the high road. There's quite a few vape shops that were selling under the counter that have disappeared too. So they attack the actual dealers, which is why things like nitrous oxide is still legal to use. So if you're walking around with a cylinder, it's still legal, and you see them everywhere, usually with balloons as well. So anything now sold for psychoactive purposes, you can be prosecuted for dealing. The only thing that was exempt from that was nutmeg, because it is a hallucinogen, but it's classed as a foodstuff. Okay, so anything now sold for psychoactive purposes, you can be prosecuted for if you deal it. Okay. Cool. Right, last of all, it's the prescribed drugs, and we've done a lot of these, but this one, the reason I like this is because it gives some of the street names. And one of the things I love about substance misuse is some of the inventive street names you get. Sleeping pills and tracks, candies and downers, we all know. Benzodiazepines are heavily misused. And there are loads and loads on the market, all prescribed by somebody into Hamlets, but they're all finding their way onto the market. Sleep medications, not quite so much. Zolpidem definitely finds its way onto the market. Codeine, again, we went through this morning. Pancakes and syrup, I hadn't come across that one, and I've asked a few service users, and apparently any two analgesics mixed together like codeine and paracetamol or codeine and ibuprofen apparently is now called pancakes and syrup, which is a new one on me, but I quite like it actually. Yeah, doors and fours, Cody, schoolboy, you know, morphine, monkey white stuff, I think they're quite old ones. Methadone, chocolate chip cookies, mixed with MDMA. I've not actually come across that in the service. And fentanyl, China Girl, Dance Fever, Goodfellas, Tango and Cash alike. Okay, not seen a lot of fentanyl. I did have one in the surgery who is was on methadone script, not a lot, is in chronic pain, has been for about 6-7 years, needs a new knee, neck's gone because of the compensation for the knee, in a mobility scooter, is using about 50 milligrams of illicit diazepam a day, managed to stop him drinking, because he was drinking heavily too. He came in one day and I was talking to one of the GPs in the surgery. I asked him to do urine screen. He disappeared for about 10 minutes. We went and got him. He was white, he couldn't stand up. He finally admitted to us he'd put on a buprenorphine patch, when the doctor and I looked at it, it was a fentanyl patch. And somebody given it to me, thought, oh, I'll try that. It's a wonder he was standing up. It really was. But otherwise, we do have fentanyl tests now at Reset, but we haven't come across any yet. We're waiting to see if it comes in with the heroin. Okay. There's lots and lots of opioid painkillers. I'm not going to go through that lot. Biscuits, Blue Heaven, stop signs. That's not a bad one. And the amphetamines, we all know those. Dexedrine. When I was younger, that was Dexy's Midnight Runners. Yeah. Benzodries or Bennies. Methylphenidate or Ritalin. I mean, it's ADHD. We heard about it this morning. I've also got clients on it for narcolepsy. Not really misused, but people play around with it because they think they know better than the GP. So they'll either increase it or decrease it accordingly. And last of all, the favourites. You know, their favourites. And I often find with these as well, especially gabapentin and pregabalin, they're not primary drugs. They're nearly always secondary or tertiary. So the primary drug might be heroin, or even crack. But then, you know, to help them come down, they're going to use some sort of depressant. You know. So it's often, it's same as cannabis. Heavy cannabis users, it's not the primary drug. It tends to be a secondary drug.